Hi, hello, good morning, good afternoon, and good evening. I wish you all, wherever you are around the world, and I hope you all are safe and healthy. And also, I believe you all are vaccinated, so we all free from COVID, right? Okay, it's me, Hema Joseph, your NCLEX tutor, nursing officer. I would like to invite you to my tutorial, Divine Nursing tutorial. Okay, today I'm going to talk about medication administration. It's today's topic for me. Okay, because it's very important during our practice, right? And also it's very important for your exam. Definitely, the question will come from medication administration that you have to follow. What I'm going to tell you is very, very important. This question will be there always, even maybe your nursing exams or NCLEX exam or any Prometric exam, the question will be asked from this topic. Okay, so I'm going to talk a few minutes. Okay, about medication administration. Why medication administration is very important. Okay, safe administration of medication is very important, and also we are very careful when we are giving administration to our patient, because there are so many side effects we saw, and also we know there are number of medication error happening. Okay, according to the survey there will be 60% of the drug error. Okay, so to prevent that, to avoid that, we are the nurses. Okay, we are the nurses, we are taking care of our patient, we should avoid all these errors, right? So we are going to see why we are going to follow the 10 rights. Okay, we are going to see 10 rights of the medication administration. Before we have 5 rights, right? Then it becomes 6. Now we have 10 rights that we have to keep in mind. Any drug, any simple drug that you are administering to the patient, and also yourself. Okay, when you are administering medication to we are not taking self medication, still when we are with the patient we have to follow all the rights, right? There are 10 rights that we have to keep in mind every time before giving medication. Okay, the first right is the of the medication administration is right patient. Yes, very, very important. Right patient. We are thinking IPG is no, IPG is gold. Right patient identification is very important. First, check the name on the prescription on the ID band, right? So, according to the JCI, there are two identifiers such as patient full name, okay, and also the date of birth or the date of birth, and then medication medical identification number, ID number. Okay, every patient have their ID numbers, right? So sometime patient same name, okay, but we have different ID number. That's why we have to check the patient full name and the patient identification number. This is very important to avoid any mistake. Okay, any medication error. We are working for the patient. We have to save our patient, and also not only patient, to save ourselves, right? So it's the main goal is to prevent medication error for the safety of the patient and safety of our career, right? Ourselves. So they keep in mind this. Then the second one is right medication. So right medication. How you will know the right medication? You know already there is a look-alike and sound-alike medications, right? We heard that LASA. We have to follow this. Okay. Some medication examples, idolazine and hydroxyzine, the same, right? And Keflex, Keppra, and Zyprexa and Zyrtec, metronidazole and metformin. These all look alike, sound alike medication. We must be very careful before administering the drug. We have to determine carefully. Okay, it can be affected by your because doctor is prescribing medication. No, you have to check the medication prescription with a drug, okay, is the same, is the clear. When you're not clear about the medication, go to your physician, make it clear, then only you administer the medication. These all drugs should be lookalike, should keep separate. Okay, lookalike, sound alike drugs should be keep separate, so you are not confusing when you're giving medication, right? Next is the right dose. Why right dosage is very important. Dosage is carefully determined by the doctor, because when we administer the drug, we are contacting so many, children, infant, adults, old age people, pregnant women, with a different medical condition patient, we are contacting, when the dosage will be different for everything, depend on these factors, right? So, we doctor also based on these factors, and also weight, right? Very important, weight. According to the weight, doctor also he prescribe the drug, right? So dosage is very important when you are administering the different age group. Okay, you must be careful. If you are not understand about the drug dose, go to the doctor, go to your seniors, ask the drug, make it your clear your doubts, then only you administer the drugs. And the right route. Why its right route is important? Yeah, in the prescription, you check for doctor has written which route for oral, intradermal, intramuscular, intravenous. Okay, make it the prescription properly. Give in the correct route. Okay, then only medication will be the effective. Your medication which you given will be effective. Understand? Next, and also when it comes to route, you can check the orders and appropriate route prescribed. Okay, in every prescription where there will be patient name, patient medication, dosage, route will be there. Confirm that the patient can take or receive the medication by the order route. Okay, don't give IV injection to the IM. Okay, it's not right. Next is the timings. Timing is also very important. Sometimes we are miss the medication. Sometimes because of urgent we are going, we give early the medication is totally wrong. Okay, give the medication in right time. Okay, document in the right time. Well, what happen if you give medication early? What will happen? Yeah, the drug in your system will be too high. It shows too high. There will be no effectiveness. So if you give too late or you miss the drug or you ask the patient to wait for too long time, what will happen? The amount of the drug in our body is very low. There's no effective. So giving medication is no meaning if you're not giving proper time. So maintaining time is very important. So the body can respond properly for the drug that you are administering. Okay. Next is the client education. Why is the client education is important? Before giving any medication, explain to the patient. Explain the side effects. Ask the patient if there is any allergy for the medication, any allergy for the food. Okay, please ask these questions. Then you explain them after giving medication. Ask them to inform if there is any allergy, if there is any reaction, to inform you immediately. So you can contact your physician immediately for the proper intervention. Understand? So client education also play a very important role. Next is the documentation. After you give medication, what you will do? You will leave like that only? No, you have to document your the date, time, and everything in the medication. Don't forget to sign. You have to sign what medication you have given. You have to document. Document also plays an important, because you cannot miss documentation. In next shift, sister will come. What she will do? If you think if you are not document, she will give administer medication again, right? So it's totally wrong. So immediately after you give medication, document that you have given. Document if there is any patient has any allergy. If patient not take medication, you document. If the patient vomit after giving medication, that also you document. These all very important factors that you have to keep in mind when you document. Okay. And next is right to refuse. Okay, this also one fundamental right. Okay, patient has his own right to refuse any treatment, right? We have studied, right? So patient has refused to write. So we explain to the patient, still he is refuse, because we have taken already consent, right? If the patient still refuse, inform to your concerned physician. And next, right assessment. As I told you, assessment also very important. Check the patient after giving medication. Before and after giving medication, we have to assess the patient for if there is any changes after taking medication, right? You have to assess the patient condition, if it is still the same or if it's any changes, it's improved. Okay, these all you have to assess. Assessment should be done. So you have to be careful also in enter legibly. Okay, write legible. Okay, documentation when you're writing, it should be legible. uh, then you have check for any contraindication, and baseline observation should be done. Okay, this all belongs to assessment. Next is the right evaluation. Evaluation also the very important. Regularly you check the patient, ensure medications are reviewed regularly on ongoing observation if required. Okay, if you want to monitor close for some drugs, you have to monitor regularly. Okay, for hypertensive medication, any diabetic medication, cardiac medication, these all need regular observation. Ongoing observation should be there. Medication, in any time anything can happen, so the evaluation is important. Right evaluation. So these all rights you must be keep in mind, so that we can protect our patient and ourselves. Okay, the next is, in addition to the 10 rights of medication, administration and identification of patient using at least 2 unique identifiers. Nurses must also ensure medication safety in respect to the storage of medication. So all drugs should not be mixed. So you should be keep it. Now you cannot mix with look-alike, sound-alike medication. You should be keep in different storage boxes. And checking for the any expiry date. Okay, checking for any patient allergy and check for any incompatibilities. That should be documented and informed to the physician. And also nurses must be use at least 2 unique identifier. Okay, other than room number. Don't take room number, because we are so many times we confuse with the room. Or prior to all the procedure, including the medication administration, also the same. You will check the 2 identifier. That is the first, as I told you, according to the JCI. Always check the patient full name. Okay, and also what else? Patient medical identification number. These two are very important to make sure we have the right patient for the right drug administration. And then one thing also, narcotics must be in locked. Okay, it should be keep in secured place. Okay, and also we should not mixing the all the drugs together. Okay, it should keep away from the children and older person. Okay, by accidentally maybe they consume medication, and between the medication error will be more, patient will be in critical condition. That should be we always careful with the children, older people and cognitively impaired people. Okay, and also some medication should be need refrigeration, right? You must be refrigerated. So I hope you all understand within 15 minutes of this class. So if there is any doubt, please ask me. And also I thank you so much for joining with me. I hope you all understand it. Please, 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 before you go into any medication administration, please keep in mind to follow all the 10 rights, because we are working for the patient. Okay, patient safety come first before anything. Patient safety come first, and also our safety. If anything happens, we are accountable for that. So thank you so much. God bless you all. See you in the next class. Bye bye.